Hey guys, hope you're having a good day. So we've been getting a lot of questions about different conditions, if we can help with them and how you can best treat them at home. So I thought we'd make a little video series kind of going over some explainers of the conditions that we do help with that are pretty common, why they're being created and what's causing them, and then what you can do at home to kind of help with that as well as what we do in the office here. So our kind of first one we're going to start with is headaches, and more specifically cervicogenic headaches. This is probably one of the most common conditions that we see here in the office. And it's really nice because it responds really well to care here, and you can do a lot of stuff at home to help with these as well. So what is a cervicogenic headache? Well, as the name implies, it is a headache that is generating from the neck. So what we typically see is irritation to the nerves that are actually exiting out of the upper part of the neck, going up the back of the head and wrapping around into the front of the face. Now, these can be irritated from a whole host of different things, right? Whether that's joint restriction leading to irritation, whether that's muscle tension, muscle spasms, trigger points, tension points, right? All these different things that we typically see. Now, what causes that, right? Well, joint dysfunction can be caused from maybe you're sleeping the wrong way, extra stress and tension, the way your head is being positioned at work, right? Forward head posture. If you're on your phone, if you're on your book, if you're on a computer, right? The student syndrome, as I like to call it. All these different things can create irritation back here that can then distribute and refer pain up and around into the head. So this headache actually is not caused by the actual head itself, right? It's not a blood pressure issue. It's not the nerves inside the head being irritated. It's literally these nerves from the back of the neck referring the pain up to the front. So this little picture here kind of shows you distribution of these three little nerves, as well as the muscles that are coming out the back. This is showing that trap trigger points are another big cause of that and how they actually refer. This shows the distribution pattern. So people who experience these headaches, right, typically they're going to get pain in the back of their neck. It's kind of that back of the head or like right underneath the skull where the skull actually sits on your neck. But they can wrap around. And where I see it most common is going to be like above the eyebrow, behind the eyeball, in the ear, or even the jaw. Yes, TMJ or jaw pain can actually be caused from your neck. And then this picture over here is showing you a distribution of muscles that are really important, the SOT muscles or suboccipital triangle muscles. These are really, really tiny muscles that sit on the back of the head. And their main function is to distribute information to the brain on position. So as your head moves and turns, these muscles change length, and that nerve is communicating to the brain, telling where the head is in space. They're really, really small muscles. We have really big muscles back here that are doing a lot of our big global movements. These little muscles here are meant to do nice fine-tuning movements. But when we think about forward head posture specifically, the head wants to drop forward. And as it drops forward, every muscle here on the back of the neck is going to try and lift it up. And these little tiny muscles even kick in, and that can lead to a lot of irritation, a lot of pain, causing this irritation to the nerve, distributing it, causing a cervicogenic headache. So hope this answers some questions. I know a lot of you guys have been asking us in the office, so I wanted to go over some stuff. Follow along for our next video. We're actually going to show how we would treat this in the office. There's some things you can do at home as well to help with this. But hope you're having a great day. Look forward to seeing you in here.